pain on one side of your lower back, kind of right in this area, it's most likely due to your SI joint. That's where the sacrum, part of your spine, meets the pelvis, and you have one on each side, and it's a very common area of pain. It can occur for multiple reasons. It happens during pregnancy because the ligaments around, well, all ligaments tend to stretch out a little bit, and so when the ligaments around that joint kind of stretch out, it leaves it a little bit less stable, especially if you have any weakness in the muscles surrounding that joint. And it can also happen if you have any hypermobility. Sometimes arthritis also causes pain in that joint. But the best thing you can do is really strengthen the muscles around that joint, because they're going to help stabilize that and get you out of pain and just get you feeling a little bit better. Basically, the stronger your muscles are, the better you're going to feel. So we're going to go through some exercises that you can do today if you're feeling any pain in that area. And this goes for anyone. If any of these exercises cause an increase in pain, then you may not be ready for them, so just skip those. But these exercises can really kind of calm down that area and strengthen the muscles around the joint so that it makes you feel better. So we're going to start actually lying on our side. And this exercise is one that won't necessarily work on strengthening, but it's going to work on some mobility in the muscles kind of around that area. So it can help decrease the pain initially so that you can do some of the strengthening exercises. Because it's hard to do the strengthening exercises if you're in so much pain that you can't really do them. So what you want to do first is lie on your side, straighten the bottom leg, and whichever side hurts, because it's usually one side or the other, that's going to be the top leg. So you're going to take that leg, bend your knee, and you're going to tap your knee in front of you, and then tap your toe behind you. Nice and slow, tap your knee, tap your toe. And you want to do that about 10 to 15 times, just to kind of loosen up that area, and then we're going to get into the strengthening. So once you've done that, you want to lie on your back, grab a yoga block or a pillow or a little ball and place it between your knees. And we're going to start really simple. Just squeeze whatever object's between your knees, squeeze it, hold for 5 seconds, relax, squeeze, hold for 5 seconds, relax. Repeat that 10 times. Once you've done that 10 times, you're going to squeeze, lift up into a bridge, come back down, relax. Squeeze, lift into a bridge, down, and relax. You also want to do that 10 times. If that increases your pain, because sometimes it's really flared up and that can increase your pain, just skip that one for now. Okay, for the next one, you're going to take this block, bring both legs up like this, push it against one knee, hold it with the opposite hand, and the other hand goes straight up, and then you're going to bring your leg and your arm down and back up. So tap and back up, tap and back up. You want to do that 10 or 15 times, and then you're actually going to do it on the opposite side as well. So tap and up, tap and up. Again, 10 or 15 times. Again, that's a little bit more advanced, so if you feel like that one is too painful. Now, like I wanted to say, that it's okay to have a little bit of pain. So if you're experiencing pain with these exercises or discomfort up to a 5 out of 10, that's okay. You can keep pushing through. Because we're not going to be totally out of pain when we do these exercises, so pain is normal. Now, if it starts increasing a lot, that's when you want to back off or just stop that exercise. Or you start the exercise and it's like a 6 out of 10, 7 out of 10, or you feel like you can't do it properly, then you may want to skip that exercise. But a little bit of pain or discomfort during the exercise is totally okay. Okay, so for the next exercise, we're going to come up on our hands and knees, and we'll put the block away for a minute. In this position, we want to do what's called a bird dog. So we're going to get arm and a leg out, nice and slow, because if we do it too quickly, you kind of wobble all over, and we really want to focus on keeping our core strong and tight. So you also want to incorporate your breathing, so you can exhale as you lift here, and inhale as you come back down, exhale, and inhale. That you want to do 10 or 15 on each side. And then we're going to finish with one that's a little more challenging. So you're going to place that block or a ball or pillow between your knees, kind of curl your toes under. For this and for all, you want to make sure you kind of tighten up your core. So you want to pull your belly button kind of up and in, just gently, you're not sucking in. And then you want to exhale as you lift your knees off the ground slightly, pause for a couple seconds, come back down and relax. So pull your belly button up and in, exhale as you lift, hold for a couple seconds, and come back down. The goal for that one is to start with 1 set of 10, and then you can work up to 2 sets of 10. All of those are going to work on some core strength and hip strength and really stabilizing around that SI joint and decreasing your pain. These exercises I would do probably every other day. Some of them you can do every day. You just don't want to irritate it too much. So if you feel good doing it every day, go right ahead. But I would at least do them every other day. And then just be consistent. It can take a while for the pain to go away completely. And you do want to kind of progress these exercises more after you get the hang of all of these, just so that you're really working on the strength of all of the muscles, especially those glutes in your core. So try those and hopefully it makes you feel a little bit better.